You ever thought about a heart that doesn't just beat, but clicks? A constant, rhythmic, mechanical sound that's a reminder of the technology keeping you alive. Well, today, we're going to dive into the absolutely fascinating world of metallic heart valve replacements, where biology and engineering meet in, well, the most personal way you can imagine. You know, for hundreds of thousands of people, this isn't some sci-fi concept. It's the actual, audible reality of their day-to-day life with a mechanical heart valve. But how does someone even get to this point? What goes wrong? It all starts with a fundamental problem in our heart's own beautiful, but sometimes pretty fragile design. Okay, so our heart is this incredible pump, right? And it has four super important valves: the aortic, mitral, tricuspid, and pulmonary. You can think of them as perfect little one-way doors, making sure blood flows exactly where it's supposed to, with amazing precision. But when one of these biological doors starts to break down, the whole system can get thrown into chaos. So how exactly do these doors fail? Well, it really just boils down to two main issues. They either get stuck or they start to leak. On one side, you have the stuck door problem, which we call stenosis. And on the other, you've got the leaky door problem, known as regurgitation. Stenosis is kind of like trying to shove your way through a door that's only cracked open a tiny bit. The valve leaflets get stiff, maybe even fused together, and that creates a major bottleneck. This means the heart has to work incredibly hard just to squeeze blood through that narrow opening. And that systolic pressure grading you see here, just think of it as a way to measure how much extra force the heart is having to use. A reading over 60 is a huge red flag that the heart is under some serious and honestly unsustainable strain. Now, regurgitation is the complete opposite problem. In this case, the door just won't seal shut properly. So with every powerful beat, some of that blood leaks backward, which forces the heart to pump the same blood all over again. It's just super inefficient. A key thing we look at here is the ejection fraction. A healthy heart pumps out about 50 to 70% of its blood with each beat. When that number drops below 50%, it's a really clear sign the heart is losing its pumping power and is really struggling to keep up. So when our own biological doors fail this badly, we need a whole new solution. And that is where some brilliant engineering comes in, with the invention of the metallic or mechanical replacement valve. And these aren't just any old replacement parts. I mean, they're true marvels of engineering, built from incredibly tough materials to handle the relentless rhythm of the human heart. They are literally designed to open and close over 3 billion times in a person's life without wearing out. Just think about that. But with this amazing mechanical fix comes a very unique and, frankly, kind of wild characteristic: the sound. And this brings us to probably the most distinct part of living with one of these devices. It's something that completely changes the very soundscape of a person's life. That is the sound of life. A crisp, audible click with every single heartbeat as the mechanical parts snap shut. For the patient, it becomes a constant companion. But for a doctor, this sound is way more than just a cool fact. It's a vital diagnostic tool. This is exactly what they're listening for. You know the classic lub-dub sound of a heartbeat, right? Well, the lub is the first heart sound, and the dub is the second. A new mitral valve clicks with the lub, while a new aortic valve clicks with the dub. Getting that timing right, along with a specific faint murmur that's actually totally normal for these valves, tells a doctor that this amazing piece of engineering is working perfectly right there inside the body. But you know, like with any major medical procedure, this lifelong solution is not without its challenges. There are some serious complications that both patients and doctors have to constantly be on the lookout for. The biggest concern by far is blood clots. The body sees the valve as a foreign object, so clots can form on it and then travel to the brain, which could cause a stroke. To prevent that, patients take blood thinners for the rest of their lives. But that creates this tricky balancing act, because too much thinner can lead to dangerous bleeding. And then there are other risks, like bacteria causing a serious infection on the valve, or the valve itself just malfunctioning. And this is where the patient becomes their own first line of defense, which is pretty incredible. The sound of their own heartbeat becomes like a built-in alarm system. If that familiar crisp click suddenly sounds muffled, or if a new leaky or whooshing sound shows up, that's a critical signal that something might be wrong, and it is time to see a doctor right away. Because of all these risks, living with a metallic valve isn't a one-and-done surgery. It's a lifelong partnership between the patient and their medical team. It's a real commitment to careful and continuous management. This management really boils down to two key things that just become part of your new routine: regular checkups and tests to keep an eye on the valve and the body, and a daily medication plan to manage those risks we just talked about. So on the investigation side, patients need frequent INR blood tests. This is to make sure their blood thinners are in that perfect Goldilocks zone. Not too thick, not too thin. They also get regular chest x-rays and echocardiograms, which are basically ultrasounds of the heart, to give doctors a direct look to confirm the valve is moving smoothly and sitting exactly where it's supposed to. And for treatment, the absolute cornerstone is anticoagulation, usually with a medication like warfarin. This is non-negotiable for life. Patients also have to be extra careful with other procedures, even just going to the dentist. And they often need antibiotics beforehand to prevent any stray bacteria from setting up shop on their new valve. So there you have it, a mechanical click that represents both a huge triumph of medical engineering and a lifetime of really careful management. It's a remarkable solution for sure, but as technology just keeps getting better and better, you have to wonder, will we one day have replacement valves that are just as durable, but without the sound and without all the risks? Maybe the future of heart valve replacement isn't in mechanics at all, but back in biology, with new valves grown from a patient's own cells. The possibilities really are as endless as the human heartbeat itself.